Living with severe depression can be extremely challenging. While medication and therapy may help improve symptoms, some patients need a different approach. In this video, I will explain transcranial magnetic stimulation, known as TMS. It is an FDA-approved, non-invasive and outpatient treatment option for patients with treatment-resistant depression. TMS works by producing magnetic fields that in turn stimulate the nerve cells in the brain. And we're talking about magnetic fields that are specifically targeting the part of the brain that modulates and controls our mood. You would be a good candidate for TMS if you have not responded to 2 or more antidepressant medications. So if you've had an adequate dose of the medication for an adequate duration of time, which is typically 8 to 12 weeks for most antidepressant medications, and if you've had just a partial response or no response, or if you're not able to tolerate any of the side effects from medications, or if you have illnesses that prevent you from taking medications, then you would be a great candidate for TMS. TMS is a very safe treatment modality. There is no anesthesia. It is non-invasive. It's an outpatient-based treatment which many people squeeze into their busy schedules either during their lunch breaks or start their day or end their day with TMS. Usually, we start to notice improvements in mood by the 2nd or the 3rd week of your treatment. This is not a substitute to your antidepressant medications, so please continue to work with your outpatient provider while your TMS treatment is going on, even though we monitor it at a very close level in the clinic. TMS is a highly effective treatment for treatment-resistant depression. The effectiveness and the response rate of the TMS is typically about 50 to 60%. So there is a huge improvement of symptoms with this treatment modality, and this has been repeatedly shown in research in many clinical trials.
When I had my second baby and the depression was really tough. You know you have the most precious thing in front of you. You know you're so blessed to have them, and you just can't feel any joy. You can't smile and be happy about that. So that's when I really knew that things had to change and I had to do something. The treatment itself is only 18 minutes. There's no pain, just a sensation. You feel that little sensation in your head. Not painful at all. And you are able to talk to the nurse that is with you in the room. So now I have the energy to sit on the floor and play with them and roll around and go out for walks and take them to the park and do stuff that I always dreamed of, you know. And with the depression robbed that from me. And I was so sad that I really wanted to do it and I couldn't. I just couldn't find in myself the energy to do those things that I dreamed my whole life about it. And then finally I'm able to, and it's just so wonderful.